Hello, everyone. If you don't know me, I'm Carrie Dick, President of KDI Wealth Management, and today we have with Nylene Ellingson joining us again for the, I don't know, fifth or sixth year you've done this. So it's been a long time.
It has. It's awesome.
We will get started. Nylene is very excited to let us know about all the changes that we get to hear every year about Medicare. So with that being the case, I'm going to hand it over to Nylene. Welcome.
Perfect. Thank you so much, Carrie. Like she said, I'm Nylene, Senior
Okay.
Insurance Specialist. We'll have some contact information up later, but thank you guys for joining. I love to give people updates about things, and this is the time of year where people just start to get bombarded at the annual enrollment and all the commercials and mailings and things. So it's always nice to have somebody trusted that you can ask questions, even if it's just you get advertisement in the mail and you want to hear about something that you read or whatever. I will say I represent about 11 Medicare companies and over 100 Medicare plans, not to mention the private side. So, and we'll talk a little bit more about that. I love what I do. I got into this, I used to be a dental hygienist, and I got into this about 10 years ago and absolutely love advising people as to their options because I'm a big proponent of saying we don't know what we don't know. And so we don't even know sometimes the questions to ask to get the best information. So we'll talk about what we can that's changed. There are certain things that will change for the new year, like Medicare rates for Part A and B and things that haven't been announced. They usually announce those closer to the end of this month. You can look up projected increases, but there's a couple things that have been announced and we'll go over that. Most of you that are on this call are probably on some sort of Medicare plan, whether that's a supplement or a PPO or HMO Advantage plan. And they're both wonderful. They're very different. But every year in September, people usually get what's called an annual notice of change, and it comes from your carrier telling you anything that's changing about your plan for the following year, whether that's an improvement in a benefit or something getting more expensive. So I always encourage people to look over that annual notice of change. It's the only thing that's not usually propaganda junk mail that comes to you. And see if it still looks like a good fit for you, or if you're happy with the rate on your supplement. We're seeing those rates increase a lot more than years past, and that's just across the board. So looking over that notice of change and seeing if your plan is still a good fit. But this is the time of year it's always good to maybe shop around if you have some really expensive medications and see if there's something that would cover those better. Or if your needs have changed, like maybe you're traveling more and you need a PPO instead of an HMO, or your plan may be terminating this year. Sometimes you get a notice that your plan is exiting the county that they're in, or this year, United Healthcare in Maricopa County got rid of all of their PPO plans. And so there's been a lot of disruption this year, but there's still a lot of amazing, stable, fantastic Medicare plans. Medicare's not going away. Advantage plans aren't going away. Supplements are still an option. You still have all the options. It's just if something's not working for you, or maybe you're just really mad at the company you're with because they've been hard to work with. Whatever the reason is, this is the time of year from now till the 7th of December that you can make a change. So, and we will have as much question and answer time when we're done with this as anybody would like. So I'm going to share my screen and just pull up a little presentation that I find helpful to answer a lot of questions. This is my family, just so you guys know. My husband and I just celebrated 18 years, and then we have 3 girls and a boy, and they are so much fun. Okay, so this is what I go through to explain when people have, and we'll talk about some of the changes as we go, Medicare. So some people might be on this webinar because you're looking at retiring, or because you're going to be turning 65 and can join Medicare, or maybe just you're on it and you want to hear what's different. So Medicare is the Part A and B red, white, and blue card that you get from Social Security. Part A is hospital, Part B is medical, and they each have a deductible and things that we'll talk about. But when people have this card, you are either 65 or have a disability that qualifies you for Medicare. And Medicare is great, but Medicare will pay 80% of things leaves people with 20% and no cap to what 20% hits in a year. So people always want to see what can go with Medicare. But we'll talk a little bit about the parts here real quick. Part A is known as hospital insurance, and most people pay nothing for it each month because you've worked enough or your spouse has worked enough in your lifetime. And it's what covers your inpatient stays, skilled nursing, home health, and hospice care. If someone only has that red, white, and blue card and nothing to go with it, then there are some pretty big costs once you're hospitalized, like a $1,676 deductible this year. And that's not yearly, it's a benefit period, so it could apply 5 times a year. That goes away when you choose any plan to go with your Medicare. So this is a slide that shows you why you don't want to only have a red, white, and blue card as your only insurance. If you're in the hospital more than 60 days, then you start to pay $419 a day. More than 90 days, it goes up and up. So hospital insurance, you don't pay a monthly premium. These are the costs you would have if you went to the hospital with nothing but Medicare. But all of these costs go away when you choose something to go with it, which we'll talk about. Medicare Part B is what Social Security bills people for. They either bill you if you're not drawing Social Security benefits, or they take it out of your Social Security check if you are. And the base rate is $185, but it's income related, which I'll show you on the next slide. But the medical portion of Medicare covers all of your doctors, specialists, lab work, imaging, all those types of things are Medicare Part B. And this is the income slide. So a lot of times people are very familiar with IRMA, which stands for Income Related Monthly Adjustment Amount. So if you are a single person and you're making more than $106,000 on your taxes, you're going to pay more than the $185. Married, it's $212. So you can see these different brackets. And so if somebody was up here, say, making $340,000 a year, you're paying more than the $185, you're paying $480 for Part B, and you have an extra amount you have to pay for Part D, whether you take a plan or not. They just are going to charge you. So this is the slide. They always go back 2 years ago tax return to base this. If you know that 2 years ago your tax return was higher or lower, you can let Social Security know and they will adjust that rate to what it currently is. Otherwise, they go back 2 years and base what you're going to pay for Medicare on that. Okay. Part B has a more reasonable deductible. This year it's $257 and it's yearly. So you pay that $257 the first times you see a doctor or get lab work or anything like that. And then after that, Medicare pays $80 and you have 20% of the cost of things. We don't love the deductibles or 20% with no cap. And so there's very different options you can have to help cover the 20% you're left with. So that's what we're going to talk about right now. So Part A was hospital coverage, Part B is medical, and then people, if you're already on Medicare, you're probably on one of these two options, and they're both amazing. So the first one is known as a Medigap plan or a supplement to Medicare. A lot of people, if they've been on Medicare for a very long time, they might have a supplement plan F, but anybody who started Medicare after 2020, the most comprehensive plan is Plan G. Or a lot of people are on Plan N is another great one. So the way that supplements work is every company you can think of sells a supplement to Medicare. They're going to tell you, hey, pay us this monthly premium. Maybe it's $100, $150, $200 more. Just depends on your age. But you pay a monthly premium and then you don't have co-insurance at the doctor. So it's very easy to know exactly what you're looking at. It's your premium plus the Part B deductible. So if you're on Plan G, which is the most comprehensive one someone could choose right now, you'd pay that $257 deductible and your monthly premium, and that's all you pay in the entire year. You don't pay for a surgery, an airlift, chemo, nothing. Medicare would pay its 80% and your supplement would pick up the 20%. A lot of people are looking at Plan N because it's about $50 less per month on premium. And the main difference is you can pay $20 at a doctor visit or $50 at the ER. So those are some differences there. The beautiful thing about a supplement is it works anywhere in the country that's accepted by Medicare, which is most every doctor you're going to find. You can also be seen at the Mayo Clinic if you're on a supplement. And yes, you just pay each month and never pay at the doctor. So it's pretty lovely. The only downside to a Medicare supplement is the price goes up every year. In the past, we used to see maybe like 6% increases, but this year we're seeing 25% increases on premium. And so people have been a little bit more shocked by some of the rate increases they've seen. One thing to know about this type of insurance is you can always shop it, just like home and auto insurance. If you're healthy enough to pass a few health questions, like, did you have cancer in the last 2 years? If the answer is no, great. Or COPD or some big things. If you're healthy enough, you may be able to change from, say, a Blue Cross supplement to a United Healthcare one or Humana or something and lower your monthly cost, but keep the same exact coverage you had. So these plans, you never have to worry about, does my doctor take it? They take it, and they're great. They'd only cover what Medicare does. So Medicare supplements do not have any routine dental, vision, or hearing as part of it because Medicare does not pay those things. So excellent coverage. You pay a monthly premium and you don't have any co-insurance. When you choose a Medicare supplement, you always want to add a Part D drug plan. So A was hospital, B was medical, D is drugs. And there's about 11 plans to choose from, and they range from zero cost to over $130 a month. And there's really not a big difference in how they're covering your medications. So if you're someone who sees on your bank statements or things that you're paying $60 or $80 or $90 for a drug plan, please reach out and let's check and see if you can switch your plan and have just as good a drug coverage for a lower monthly premium. But there were some big changes with drugs this year and very little next year. So if somebody has some very expensive drugs, they fall on a high tier. There's 5 tiers of drugs with Medicare. Your generics, blood pressures, cholesterol meds, those are like usually a tier 1 and you pay nothing for them. Tier 2s might have a $5 to $10 copay. Tier 3s are either about $45 or else a percentage. And tier 4s, $100 copay or a percentage, and tier 5s are always a percentage. So if you have any expensive drugs, it's worth checking and seeing if there's something that covers them better. But one of the most positive changes for people with expensive drugs was last year, the maximum you could pay on drug coverage was $8,000 in a calendar year. And this year, the maximum you could pay was $2,000. That's a huge improvement for the consumer. Next year, that max is going up only $100. So in 2026, it'll be $2,100 is the most anyone could pay. Most people don't hit that at all unless they have some very pricey drugs. So that's one change that we do already know. It went up $100, so not bad. But if your plan has a deductible, which most of them do now, this year that deductible was $590. Next year, it's going to be $615. So most plans only apply that deductible to tiers 3, 4, and 5. So you don't have a deductible on your maintenance meds. And then there are some plans out there with no deductible. So something to keep in mind. And then you have your co-pays or co-insurance, and everybody caps out next year at $2,100. The second type of coverage, so you either choose a Medicare supplement, which is just private insurance you're going to purchase, or you choose a Medicare plan, which is known as Part C of Medicare. And Part C combines your hospital Part A, medical Part B, and drug coverage all into one card. And I tell people, think of it like a work plan on steroids. It usually outshines most anybody's work coverage. Rarely do I see people who have a work plan that outshines these, but it's wonderful coverage and it's part of Medicare. So you don't pay anything for it. There's very few plans that have a premium at all. Most of them are zero cost. So the only thing you're paying is that Part B premium to Social Security. And then your health plan is costing you nothing. And there's lots of options. There's here in Maricopa County, there are about 70 Medicare Advantage plan options. They are not all equal. So a lot of times people hear unpleasant things. You got to ask me about those questions, and I'm happy to answer any of the specific questions. But what I will tell people is sometimes people are like, "Oh, I've been told you can't find doctors that take these plans." Definitely not the case. When you're looking at big companies like United Healthcare, Humana, Aetna, Cigna, they have very large networks. But there are some plans out there that you could look up on Medicare.gov that have really small limiting networks, like Scan. Scan is huge in California and amazing, but here in Arizona, their plan is amazing, but the network of doctors that take it is not very large. And so, yeah, you might be on a plan and not be able to see a doctor that you want. That never happens when you advise with me. So I always help people look at the plan options, check all their doctors, medications, and find what's going to meet your needs. But the bigger companies have very large doctor networks, but you do stay in network. If it's a PPO plan, you can go out of network for a higher cost. If it's a HMO plan, you stay in that network. And on the HMO plans, you have much lower costs for surgeries and hospital stays and maximum out of pocket and more dental vision and hearing as part of them. So on Advantage plans, the reason they call them Advantage plans is because they're paying your Part A and B deductible with Medicare. So that's $1,667 and the $257 deductible are paid. So you have a no cost, no deductible health plan where you just have copays that go toward a yearly maximum. And the yearly maximums range depending on the plan or if it's a HMO or PPO from as low as $2,300 for the year to about $6,000. So 2,300 to 3,000 is usually for a HMO, and then they're a little bit more if it's a PPO plan. And most people never hit the max out of pocket on these plans. It's very rare. United Healthcare just did a survey, and about 50% of their members paid less than $300 in medical costs for the year on these zero cost health plans. So that's what I see with my clients. All of the plans come with extra benefits that Medicare doesn't normally pay, like routine vision, dental, and hearing. And they differ quite a bit between the companies on those benefits. So some of the most robust benefits, you have like maybe $3,000 in free dental or $350 for eyewear, hearing coverage, gym memberships, debit cards that let you buy over-the-counter items and things like that. So those are some of the extra benefits they give you. And then you just have copays like what you would be used to on a work plan. Always zero cost for primary and anywhere from $0 to about $40 for specialists usually. Surgeries can range anywhere from $75 to about $350 depending on the plan. And these copays go toward the maximum you could pay in a calendar year. And so they're very great plans. I always like people to know you have two amazing options. You can either choose to be on a private insurance where you're going to pay it upfront monthly premium and not have costs at the hospital or the doctors, or you can pay nothing for your Medicare plan, have extra dental, vision, and hearing that's better than I could sell somebody, and only pay as you use it, knowing that you have a maximum out of pocket for the year that's anywhere between 2,300 and 6,000. So either option is great. Most of my clients that choose to be on an Advantage plan add a small little add-on product that pays their biggest copays, like it makes hospital stays free, their ambulance rides free, and things like that. It's a either or. One thing to know is if you've always been on a Medicare supplement, maybe you're on a plan G or a plan F, and your premium has been creeping up a bit over the years, and now you're paying maybe $300 or $400 a month. We can shop and see if you can lower your costs on a supplement, or if you've never tried a Medicare plan, Medicare doesn't want you to be scared to try one. So they have a 12-month trial period where anytime in the first year of trying a Medicare Advantage plan, if you're unhappy, you can go right back to your supplement with no questions asked. Anytime in the first 12 months. So it really puts a lot of my clients at ease to give it a try if they think they want to. And in 9 years of doing this, I've only had 2 people ever choose to go back to their supplement plan after doing an Advantage plan. So it speaks for itself on patient satisfaction. but it's an option. And you can always switch between the two if you can pass a few health questions. Medicare Advantage plans never have health questions because they're part of Medicare. But the supplements or the Medigap plans are the ones that will ask a few health questions. Right now, these are the times that people can make changes. So right now, we're just starting the annual enrollment period. You can make a change anywhere from October 15th to December 7th. Anyone that's on an Advantage plan can make a change in the first quarter of the year. Anytime this IEP, this is when people are first turning 65 or retiring and choosing to go to Medicare, they can choose whatever plan they want. And anytime you have a special election period, like maybe you moved out of your area or your plan terminated or whatever, you can also make a change. So right now we're almost in the annual enrollment period. And so that's just the basics of Medicare. Only things that we know for sure that are changing that I can announce is that Part D, the drug plan, going up to $2,100 and the deductible going up to $615. So little tiny, tiny increases there. But what kind of questions do people have for me?
I have one and it says, can you go back to supplements if you have medical conditions, i.e. cancer or diabetes?
So that is a great question. So the only time you can go back while you have those conditions is if you're in that 12-month trial period, or if you can pass the medical questions, or if your plan terminated. So like, let's say you're on an Advantage plan. Maybe you were on a United Healthcare PPO plan this year, and they decided we're getting rid of PPOs. Because your plan is terminating, you have the opportunity to go back to a supplement with no medical questions asked. Otherwise, the questions usually go back 2 years and they ask things like, did you just have a hospital stay, cancer, heart attack, stroke, COPD? Those are some of the main big ones. They don't care if you're diabetic or thyroid conditions. They care about those really big ones. So it's always worth checking if you're wanting to go back to one or shop between plans. It's the same thing. You have to be able to answer those questions unless you're in a trial period. Good question.
We have another one.
Sure.
Can you have an Advantage plan and a supplement plan Part G?
No. So it's one or the other. You can't have both.
Okay. The next one is, have heard that Medicare Advantage plans often deny specialist treatment, lab work, and or take a long time to consider before approving. What is your experience?
So my experience, because you'll hear a lot of people badmouth Advantage plans, especially if they're a broker who only wants to sell supplements. And so I always tell people a couple things you have to consider when you're talking to people is I know a lot of brokers who push supplements because you can be bonused or earn vacations or things if that's like all you're selling. Advantage plans don't bonus you. I never earn a fun trip by selling Medicare plans because you're not allowed to. You want to talk to someone who sells both so that you don't get that bias of them trying to steer you one direction or another. In my experience, so I have hundreds and hundreds of clients, and honestly, the statistic in the country as well as my own business is most people choose Advantage plan when they've been shown both without bias. In my experience, I've never seen lab work or things denied ever. They do require authorization for certain things. So like this last year, I had a client that I know personally, and she was upset because Humana wasn't going to let her husband just go and have this very expensive test done. Because Medicare says, hey, unless you've done this cheaper test that shows concern, we're not going to authorize this one that costs thousands of dollars. And they just wanted to skip the step. On a supplement, you may be able to do that. There are some test states where they're starting to ask for authorizations even on a supplement for certain things. They're big things. They're not your little things. So I don't really have people who complain about, oh, I couldn't get this done or they didn't approve this. I have maybe heard that a handful of times in 10 years. So most of my clients on Advantage plans are very, very happy. And that's not something I hear them complain about. But you do sometimes have to get a prior authorization for a surgery. And they usually only take a few days, and that can differ between companies too. I stick with the companies people are happiest with. While I contract with all of them, there are certain companies I never write business because people's experience isn't happy with them.
Okay. I think you addressed this one in your presentation. I heard no choice in doctor or provider on Advantage, but I think you said if you go with one of the larger companies, your network is a lot
You
larger.
have so much choice with Advantage. Now, there are certain companies that you won't hear as much, like I will just use Scan as an example, where their doctor network is not nearly what the bigger companies is. But when you're talking about the bigger companies, I always check people's doctors. Sometimes I'll have people with 18 doctors, and every one of them's in network. So it's always nice to stay in network, even if you have a PPO plan, because you're going to pay more to go out of your network and have a higher max out of pocket anytime you choose to use out of network services. So even when people have a PPO, it's always nice to know your doctors are in network. And most
Okay.
of the time they can be.
The next one is regarding Gila County, and they have the Aetna Advantage, and they're dropping. So what
Yes.
companies are you looking at to replace Aetna?
You bet. So my clients have all received a very detailed email. I even this year broke it up by I sent only Gila County a set email because that newsletter, because in Gila, yes, Aetna is exiting most rural counties. I think Yavapai, maybe they kept one out of like 5 or 6 plans. So no Aetna, which has been people's favorite plan in Gila this whole year, for sure. Kind of outshined all of the competition by a bit. So up in Gila, you have a couple of options. You have the option to either choose another Advantage plan, and you're probably going to want to look at Humana. So I'll address this real quick. Sometimes plans will be suppressed. And what that means is the company says, we don't want more membership on this plan because if it gets too much, we may have to terminate the plan and offer something else. I don't know all the ins and outs of how they be cost effective, right? It doesn't happen a lot, but United in Gila County is at that point where they're like, we don't want new business. You can enroll on these plans, but we don't want the business. And so they made their benefits less than desirable, some negative changes for next year. Humana is going to have your strongest plan options. WellCare is an okay option in Gila. And if you have a chronic health condition like diabetes, heart disease, or kidney disease, there's an amazing plan from Gold Kidney. Just amazing benefits. So I would just call me up and we can go over options. And then you have the option, since that plan is terminating, to do a supplement plan with no health underwriting if that's something you'd prefer to go to. So there's still good options, but it is kind of sad that Gila is losing Aetna this year. They might be back the next year, but we'll see.
There's some great questions. Which Advantage plans provide coverage out of the state or country?
Oh, very good. So Medicare in general does not cover you out of the country, except limited coverage in borderline states. Advantage plans will usually cover you pretty good. Supplement plans usually have a 50,000 max per out of the country that they will pay. So there are Advantage plans. When you look at HMOs, years ago, they did not cover you in other states unless it was an emergency. And so people who traveled a lot or had homes in more than one state always went with a supplement. That has changed so much over the years. So now there's a few companies that offer a fantastic HMO, not just PPO. They offer those too, but a HMO with a national network, meaning you don't need referrals to see specialists. You can see anyone in the nation that's contracted with that company when you're traveling, and you're always on any Advantage plan covered for emergencies worldwide, in or out of network. So the companies that have really good travel benefits is United has what's called a passport program where they have a lot of states. You just have to make a phone call if you want to schedule doctor appointments in another state and say, hey, I'd like to transfer my benefits to Missouri because I'm going to be there for the next 6 months or whatever. Aetna and Humana have national networks and you don't have to make any phone calls. As long as the doctor accepts those, you can see them anywhere in the country, even on an HMO plan. So it's kind of nice because HMOs will always have a lower max out of pocket by about half and lower costs for everything, and usually more dental, more vision, stuff like that. So yeah, there's some great plans for traveling.
Right. And I think if you're traveling out of the country, you can actually buy a supplement through a travel provider that will cover
That's
it.
a super great point. So I just went to Ireland with my sister for 10 days. And so I called up my colleague who does travelers insurance, and I think we paid $60 to have $1 million policy for health while we were traveling. So very, very affordable if you are spending a lot of time out of the country. Look into that for sure.
Okay. Next question is, do Advantage plans provide a full annual physical or just the so-called wellness exam described by Medicare plans?
Good question. I hear there's lots of ranges of physicals. So they do an annual physical. How detailed that is, I don't know, because even on supplements, there's what Medicare will cover for a physical. And then there's one company on Medicare supplements that really brags about how they pay for the executive physicals. I've never even known these things. Clearly, I've never had one. But apparently, it's a very in-depth, expensive physical that's thousands of dollars because they do so much in-depth checking. So I think Medicare has what they will cover. Advantage plans, I've never had someone say, I can't get the physical that I want. And I never heard about an executive physical until a company called Physicians Mutual brags about how they're the only ones that will pay that in depth of a physical. So that's all I know about that.
So how do these plans work with or in conjunction with VA care?
With VA? Oh, great question. So my dad is on TRICARE. He's retired military. So there's VA and there's TRICARE or there's CHAMP VA. There's different things, but I'll just kind of speak to them in general. There's a fantastic Advantage plan that's designed to go for TRICARE only members. It's wonderful. It's not in every county, but it's in like Pima, Maricopa, Pinal, and Graham. And it is awesome. It helps pay your Part B premium. It has amazing health benefits, and it is designed to coordinate the billing with the company that bills for TRICARE. So that's something, if anybody's listening that has TRICARE specifically, reach out and we can talk about that. But most people that have VA benefits, some of them choose not to take Part B because it has that monthly premium. And they're like, I just do things through the VA. But a lot of people realize it can be very frustrating doing everything through the VA because of wait times and things like that. So a lot of people have Part A and Part B, and they're a veteran and they get their prescriptions through the VA. There are Advantage plans through your most competitive ones are going to be through Humana and Aetna. United has one, but not in as many counties right now. It pays the majority of their Part B premium for them. So instead of it costing, say, $185, maybe they're paying $95 of that. And then it has great benefits. Most people still like to use the VA, but you don't have to. You have an amazing health plan that costs you nothing, that helps pay that. And it doesn't have drug coverage because they know people get that so well through the VA, which is why they can pay them $95 a month to be on the plan. But the things it has that most veterans want is things like $3,500 in free dental, vision coverage, hearing coverage, free gym memberships, things like that, that they use that they don't get through the VA. So yeah, they're designed to work really well. They're even co-branded with names like USAA. Humana's is co-branded because they work so well with veterans. They have fantastic veteran plans.
Next question is, what do you think of these new clinic plans like Oak Hill and others?
Oh, yes. So these are called value-based provider groups, and I think they are fantastic. Now, they're not all equal. There's about 7 in Maricopa County, and these are names you'll probably see around: Oak Street Health, Village Medical, which are in a lot of Walgreens. They also have standalone facilities. Archwell, Centerwell, Evernorth. Who am I forgetting? There's 7 of them. They're great. Value-based providers are paid totally different than fee-for-service doctors in all the best ways. So instead of getting paid by how many people they see each day and are billing per person, they actually take the financial burden off of the health plan and they're completely invested in the member's health. They like to see you more like 2 to 4 times a year for preventative. It costs you nothing to go there. They usually have same-day appointments, in-house lab work, and some other testing. And they are paid to keep you healthy. They're paid more to keep you out of the hospital. And so they're very invested in making sure you're getting the care you need, doing the tests that need to be done, and getting to know you. So they typically spend at least 45 minutes with you, same day appointments, and really happy patients that I know that see them. So that's the difference between value-based or fee-for-service is they get paid to keep you healthy.
Okay. Let's talk a little bit about going the plans later into life. I don't think nursing
Like
home
long-term
care,
care plans.
long-term care, nursing home care, and then
Yes.
hospice. So let's talk about those three things really quickly.
So hospice is always a zero cost benefit on Advantage plans and covered by Medicare and things like that. So hospice isn't a concern, but long-term care is pricey and it's not covered by Medicare. They just never could be able to pay this, right? When it's $8,000 a month for someone's care. So it is a totally separate insurance that you'd want to look into. And obviously, like anything else, like health and life insurance, the younger you start, the more affordable it is. But yeah, they're separate insurance policies that you can purchase. Cost will depend on age and health. And it is something good to plan and prepare for. I think most of your people are planners. That's why they work with you. So it's a good thing to look into. There's a lot of new different ones, just lots of options.
Right. I think there's always a little confusion about that time. And most of the time we're not thinking about that until it actually happens. So,
Then I'll just finish up with a couple of unique things. There are plans out there that they're always trying to meet unique needs. There's a plan this year, an Advantage plan, that gives people a pretty good amount of money every quarter for things like naturopaths, which I have a lot of people who sometimes don't see any medical doctors, but they want to see a naturopath and it's not covered by Medicare. So there are plans now that help cover routine chiropractic, naturopaths, and acupuncture. I would say the most unique one this year that's popped up is a big bucket of money to see anyone in or out of network. You can just see any licensed naturopath or chiropractor or acupuncturist. So kind of cool. Just so you guys know, my name is Nylene Ellingson. KDI has my information. You can email me, text me, call me, any questions that you have. There's never a stupid question. People always say, oh, this might be a stupid question. Nope, there's just questions that we need answers for. So there's never any cost for my help. I just advise people and direct them. And the way that I get paid is I get paid by whatever plan you choose. They pay me a commission. So it keeps us very non-biased because they all pay equal.
perfect. Can you change from an existing supplement to an Advantage plan?
Yes, you absolutely can. So this time of year between October 15th and December 7th is the only time you can make that change. And then if you've never been on an Advantage plan, just know you have 12 entire months. Maybe in July, you're like, I hate this, which like I said, I've only had 2 people choose to go back to supplements. So most people absolutely love them. But anytime in that first year, if you decide I'm not liking this, I want to go back, you can. And I will help you go right back to your supplement.
Okay. And then next one's kind of along those lines is can I switch Advantage plans during open enrollment if I just enrolled in one in September?
You sure can. Yep. So this is an election period for anyone to make a change because you enrolled in September, which was before October 1st when you could know anything about next year's plans and details. So yep, you can change now. You can also, it's not an advertised enrollment period, but the first 3 months of the year, if you're on an Advantage plan, you have another enrollment period called open enrollment period. Yep. A bit of time.
And aside from Nylene, because she does both supplements and Advantage plans, how would they find an advisor who does both?
So I would use me, obviously. KDI loves me. I try to be very, very thorough and honest, but the way that you would find a broker that does both, I don't know, because people are always going to have a card and it's going to say licensed broker. I know a lot of people who only push Advantage and a lot of people who only sell supplements. And so You just have to talk to them. So there's a disclaimer that Medicare makes you play on any sales calls when you're talking about plans. And any good broker should be following these rules where they tell you right up front how many companies they represent and how many plan options. If they say I represent 3 companies and 40 plans, that's not a lot. And then ask them, do you sell supplements and advantage plans? So I guess just kind of asking them.
Yeah, and just so you guys know, I mean, 100 plans and how many companies? 7?
11
11. I mean, they have to get recertified in this every single year and know
every
all the
year.
different plans every year. So
Yep.
that's a lot of work, and to know all of that is amazing. And that's why we use you. And yes, we will be sending out Nylene's information. We'll also have a recording of this video we'll be sending out. And do you have anything else for us, Nylene?
I don't. Thank you for having me. I love giving
Of
information. And if anybody
course.
has specific questions, don't hesitate to reach out.
Yes, and thank you for serving our clients so well over the last several years. But thank you again so much. And please feel free to use Nylene for all your questions. And she's a great partner.
Thank you so much, Carrie.